Many men are affected by hair loss. Although male pattern baldness or androgenetic alopecia causes the majority of incidences of male hair loss, there are many reasons a man can lose his hair. According to the American Hair Loss Association, nearly 2/3 of men experience some degree of hair loss by the time they are 35. By age 50, as many as 85% of men experience hair loss and thinning. While there are many reasons why men lose their hair, there are also many treatment options available to help men cope with hair loss. Prevention and treatment. Prevention is often one of the best ways to treat any condition. In some cases, depending on the exact cause of hair loss, it may be possible to prevent, or at least slow down hair loss. Some of the best prevention methods include eating a balanced diet, using combs with wider spaces between bristles, avoiding harsh treatments and hairstyles, switching medications to avoid the side effect of hair loss if possible, avoiding pulling or twisting hair. It is important to remember that not all types of hair loss are preventable or will even slow down with preventative measures. In these cases, men can try to combat hair loss through active treatment. Some methods men can use to treat hair loss include the following: medications. There are medications that can be bought over the counter that may help treat hair loss. These typically come in the form of foams or other topical ointments. The two most common medications are minoxidil Regain and finasteride Propecia. Minoxidil. Minoxidil was originally developed to treat high blood pressure. Developers found that it had the side effect of excessive, unwanted hair growth. This effect gave drug companies reason to consider it for male baldness. The exact way that minoxidil works is not entirely known. The drug appears to widen the hair follicle, which causes a thicker strand of hair to grow. In addition, minoxidil appears to prolong the growth period of a hair, which results in longer hair and a higher number of hair strands. When used properly, minoxidil has been shown to be safe and effective. Finasteride. Finasteride is used to treat male pattern baldness, which appears at the crown and the middle of the scalp. This drug carries several warnings about its use. It should only be used on adult men and should be kept away from children and women who may be pregnant or breastfeeding. Finasteride was originally created to fight prostate cancer. It works by decreasing the amount of a hormone called DHT in the scalp. DHT appears to cause hair follicles in the scalp to become thinner, so by decreasing the levels of DHT, hair regrowth may increase and hair loss may slow down. Unlike minoxidil, finasteride does not affect hair growth on other parts of the body. Therapies. Therapies for hair loss often involve combinations of drugs, ointments, creams, and shampoos. Other therapies include meetings with specialists. Several companies specialize in hair treatments for men. They typically offer services to help work out the best course of action to take and tailor treatments based on the individual man's needs. Surgery. The only surgery available for hair loss is hair transplant surgery. Transplanting hair works for men with male pattern baldness. The transplant involves removing hair follicles from the back of the head, where they are resistant to DHT, and placing them on the scalp. Laser combs. Laser combs are a newer form of treatment for hair loss. It is claimed these devices promote hair growth by using concentrated light that stimulates hair follicles. This treatment has mixed results and may work best when combined with other forms of treatment. Wigs and hair pieces. In some cases, hair loss may be permanent or long-term. In others, men might prefer a non-medical way to treat hair loss. Wigs and hair pieces offer a means to disguise hair loss. Wigs and hair pieces have advanced enormously in the past several years. If the baldness is caused by a medical condition, the cost of a wig may also be covered by the person's insurance provider. Causes. Men can experience baldness or hair loss for different reasons. While there are many causes for hair loss, the most likely cause is genetics. Finding out whether or not hair loss is caused by genetics or another reason can help determine the best course of treatment. Male pattern baldness is a hereditary condition and is the most common cause of male baldness. It can start as early as puberty or develop much later in life.